Welcome to this video about dumping syndrome. Today, we'll delve into the causes, symptoms, diagnosis, and management of this often misunderstood condition that can significantly impact a person's life after certain types of surgery. Dumping syndrome occurs most frequently after surgeries that remove all or part of the stomach or bypass the stomach for weight loss. Procedures like gastrectomy, gastric bypass, and esophagectomy are the most common culprits. Less frequently, it can arise from vagotomy, a surgical procedure that cuts the vagus nerve, or even from underlying conditions that affect the stomach's ability to regulate the release of food into the small intestine. Imagine your stomach as a carefully controlled gatekeeper, slowly releasing digested food into the small intestine. In dumping syndrome, this gatekeeper is weakened or removed. This results in a rapid dumping of large amounts of undigested food, particularly sugars, directly into the small intestine. This sudden influx draws fluid from the bloodstream into the intestines, leading to abdominal distension and cramping. The rapid absorption of sugars then triggers a surge in insulin, potentially leading to a drop in blood sugar levels later on. All of these physiological changes contribute to the characteristic symptoms of dumping syndrome. It's difficult to provide precise epidemiological data, but dumping syndrome is a relatively common complication following gastric surgery. The incidence varies widely depending on the type of surgery performed and the specific diagnostic criteria used. Studies suggest that early dumping syndrome may affect up to 50% of patients after certain types of gastric bypass surgery, although the prevalence of persistent, severe symptoms is lower. Late dumping syndrome is less common overall. The symptoms of dumping syndrome are often divided into early and late phases. Early dumping syndrome occurs within 30 minutes to an hour after eating. Symptoms include abdominal cramping, nausea, diarrhea, vomiting, bloating, flushing, sweating, rapid heart rate, and lightheadedness. Late dumping syndrome typically occurs 1 to 3 hours after eating and is characterized by symptoms of hypoglycemia, such as weakness, sweating, confusion, tremors, dizziness, and difficulty concentrating. Some individuals may experience both early and late symptoms. Diagnosing dumping syndrome typically involves a combination of medical history, symptom evaluation, and sometimes diagnostic tests. Your doctor will likely ask about your surgical history, the timing and nature of your symptoms, and your dietary habits. A glucose tolerance test, where blood sugar levels are monitored after consuming a sugary drink, can help confirm the diagnosis of late dumping syndrome. Gastric emptying studies, which measure how quickly food leaves the stomach, may also be used to assess the rate of gastric emptying. While there aren't strict types of dumping syndrome, it's primarily classified based on timing early and late. Early dumping syndrome, as we discussed, occurs shortly after eating. Late dumping syndrome, on the other hand, occurs several hours after eating and is related to reactive hypoglycemia. The cornerstone of dumping syndrome management is dietary modification. This includes eating smaller, more frequent meals, avoiding simple sugars and high-carbohydrate foods, increasing protein and fiber intake, separating liquids from solids during meals, and lying down after eating to slow gastric emptying. Medications, such as octreotide, a synthetic hormone that slows gastric emptying and inhibits the release of insulin, may be prescribed in severe cases. In rare instances, surgery to reconstruct the stomach or reverse a previous gastric bypass may be considered as a last resort. While completely preventing dumping syndrome isn't always possible after gastric surgery, certain strategies can significantly reduce the risk and severity of symptoms. These include adhering to the dietary guidelines recommended by your doctor or dietitian, slowly introducing new foods after surgery, and carefully monitoring your symptoms to identify trigger foods. Early intervention and management can help prevent long-term complications. The prognosis for most individuals with dumping syndrome is generally good. Many people find that their symptoms improve significantly with dietary modifications and lifestyle adjustments. While some individuals may require long-term medical management, dumping syndrome is rarely life-threatening. Recent research has focused on developing more effective medications and dietary strategies to manage symptoms. Studies are also exploring the role of gut microbiota in the development and severity of dumping syndrome. Ongoing research is continuously improving our understanding and treatment of this condition.